So hand surgery can be done by plastic surgeons or orthopedic surgeons, and it varies a little bit what they offer. But in general terms, hand surgeons, when they are plastic surgeons, are addressing more of the soft tissue. And this can include trigger fingers, tendon repairs, nerve compression syndromes, or reconstruction after a trauma when you have lost a lot of your soft tissue. So there are functional aspects and aesthetic aspects for plastic surgeons. In addition, we see children, and in children, in addition to trauma to the hand, they come with congenital hand differences, as we call it, where the hand isn't formed as normal and either fingers are missing or can be fused. So this is very often done by a plastic surgeon. Various diagnoses, which are very common, as I just mentioned, can be trigger fingers, carpal tunnel nerve releases, such as carpal tunnel or cubital tunnel release. But we also treat ganglions and joints like arthritis or rheumatoid arthritis, joint replacement. And in children, as we just mentioned, we address the needs for a congenital hand difference, where we either add fingers, remove fingers, or give them the web space if it's missing, for instance. For hand surgery, the decision on what type of surgery is appropriate is slightly different from other types of surgery. Here, it's very important to know, firstly, the patient age, how they use their hands on a daily basis, meaning what type of profession they have. Are they manual workers? Are they working desk related? What is their dominant hand? And do they have any particular hobbies, particular sports, musical instruments, or are they even professional musicians or sports people? This has an incredible impact on the type of surgery and the recovery we have to explain to patients. So if you have a patient who is a manual worker, he might prefer to have a quicker recovery with a very good grip strength rather than a very delicate surgery with long months of hand therapy. Whereas if you have a child, for instance, you have to think about the long-term implications of the surgery you offer. So this is the main difference from other types of surgery we'll take into account when we take decisions on hand surgery or discuss with the patient. Hand surgery procedures are quite delicate, and not only in a small child. When you might imagine, if you have a baby, every structure will be tiny, but even in an adult, all the structures, the nerves, the vessels are very small, and you have to be very meticulous in your dissection. To be able to do that, we normally need a bloodless operation field. So we're using a tourniquet, which is effectively a blood pressure cuff at your upper arm to keep the blood out of the arm during the surgery. Alternatively, there is a new technique called Valent, where you inject some local anesthetic with a substance called adrenaline that also reduces the blood supply to the operation field. Either way, once you have a fairly good vision of your operation field, we also use loop magnification. This can be either a specific pair of glasses or a microscope to make sure we can see all the structures as well as possible. Meticulous dissection is really important for the long-term outcome and the recovery. So the better you can dissect and put things back together, the better the outcome will be. This is a principle, of course, for all surgery, but it is particularly important in hand surgery. The main concern in hand surgery, or post-operative in hand surgery, is swelling of the hand. If you have swelling, the joints in your hand don't like swelling, and they tend to become stiff. To prevent this, we firstly, as we already mentioned, try to be as meticulous in our dissection and as little bleeding as possible. We will advise any patient how to prevent the swelling from happening by elevation of the hand. And we have a dedicated hand therapist. Depending on the type of surgery we do, we have to outline a recovery plan together with a hand therapist to treat the patient post-operatively. This is the best prevention against swelling and stiffness of the joints. The second most feared, I would say, risk in hand surgery is something called chronic regional pain syndrome, which effectively is a prolonged pain out of proportion to the type of surgery you've done and prolonged swelling of the hand. this will lead also to loss of function and problems potentially longer term. This then affords very intensive hand therapy, potentially medication to assist with the pain, and a long-term follow-up and recovery will follow. So these are the main sort of problems we encounter. Luckily, they're very rare, as long as you stick to this sort of golden rules in hand surgery. Recovery is very variable in hand surgery, depending a lot on what type of surgery we do. It can be as short as 2 weeks if we do a small procedure like a small ganglion on the finger or a trigger finger release, up to 3 to 6 months if we do a joint replacement or a major reconstruction after a trauma. So usually, even in a small procedure like what we think small procedure carpal tunnel release, the recovery can take 3 to 6 months until you regain full hand function. So depending on that procedure, your consultant should always discuss with you the recovery time, because it is very important to know what you, how you plan the rest of this year if you go in for hand surgery, and how you can go back to work and do your daily activities. So it's very important to discuss this and counsel the patient preoperatively about these recovery times. Also, that hand therapy is a crucial part of the treatment, and that is part of the recovery process as well. Patients, I think what they can do is follow all the instructions the surgeon or the hand therapist gives them, and make sure to elevate the hand in the early post-operative phase, not to overdo it. Sometimes patients are too keen, and that again can lead to problems, but also not to underdo it, to really follow the instructions. And otherwise, most often the outcome is actually very good after hand surgery.